Hi there! Welcome to another episode of What the Health. I'm Janelle Thompson, the nurse practitioner at your Hawkeye Student Health Clinic, where all of your office visits are free. Today we're going to talk about some medical myths and debunk them. So our first myth is, if you swallow a piece of chewing gum, does it stay in your stomach for 7 years? The answer is no. So when chewing gum gets swallowed, it lands in your stomach, and it actually only stays there for about 60 minutes to 120 minutes. So it might stick to your shoe for 7 years, but it doesn't stick actually in your stomach. After that amount of time, it goes into your intestine, and it does stay in its solid chewing gum form. It's indigestible, which is the same as many fibers and many nuts and seeds. It works its way through the intestine, and then it comes out in the same chewing gum form and goes into the toilet. So our next myth involves the pedometer and walking 10,000 steps a day. There's actually no scientific evidence that says that we need to be walking 10,000 steps per day. So this came from the 1960s. There was a Japanese businessman and inventor who started marketing a pedometer that he had made. And the name for the pedometer, when it was interpreted, actually meant 10,000 steps. So that's where that catchphrase came. 10,000 steps, no research behind that, but the recommended amount of exercise really is 30 minutes per day for most of the days of the week. Myth number 3, cracking the knuckles of your hands is going to cause arthritis. Not true. When you crack your knuckles, you're increasing the joint space, and that actually creates a stretching that develops a small air pocket within the joints. That air pocket bursts, and it makes that noise. Does not cause arthritis. Arthritis, the most common kind in the knuckles, called osteoarthritis, is a result of the cartilage being worn down. It's not a result of cracking. Myth number 4. Using a dirty toilet seat is going to get you a sexually transmitted infection. Okay, nobody's going to argue that dirty toilet seats are absolutely gross. Nobody likes to go to the bathroom in a gas station. But a sexually transmitted disease is caused by a bacteria, a virus, or parasites. Now, parasite infections have a really low chance of being able to be contracted by a toilet seat. Absolutely almost nil. A parasitic infection would be like pubic lice or crabs. So for that to actually happen, you would have to have somebody who has crabs sit on a toilet seat. The crab would have to let go. It would have to sit on the toilet seat where it had nothing to hold on to. They like to hold on to things. It would have to then wait there for somebody else to sit down so it had something to hold on to. So very unlikely, very unlikely. But recommendation, if you're going to use a toilet seat at a place that you think is not fit to be used, hover above it or use one of the little tissues that you can put on the seat, or just hold it. Myth number 5, turkey makes you sleepy. No, it does not. So, turkey does contain tryptophan. Tryptophan is an amino acid that is a component of a chemical that can make people feel more relaxed. Now, tryptophan is in a lot of foods. It's in milk, cheeses, nuts. There's actually more tryptophan in cheddar cheese than there is in turkey. So what makes you so tired after your meal at Thanksgiving? A combination of things. The large amount of carbohydrates that we usually have, turkey, overeating, and usually some alcohol's involved with that too. So that all creates a great environment for a good snooze. And our last medical myth today, an apple a day keeps the doctor away. So, an apple certainly contains high levels of vitamin C and fiber, and both of those are very good for long-term health. But when it comes to somebody getting sick, this is caused by bacteria and viruses, and having an apple a day isn't going to treat that or prevent that from happening. So, in the long run, if you want to prevent yourself from getting sick, good nutrition is important, but more important would be keeping up on your immunizations and vaccines that are recommended. Thank you for joining me for another episode of What the Health. I'm Janelle Thompson, your family nurse practitioner. Please continue to send questions and comments our way, and you too can be featured with your question on What the Health.